This fellow, we did 1,500 grafts just to his hairline with FUE, and you can see this is about the change you'd expect after 1,500 grafts. The younger the patient, the more you worry about future hair loss. And if we plant these in the front and you had somebody, let's say this same amount of hair loss in a 25-year-old, and we were to redo his hairline the same way as we've done, you'd be very concerned about future hair loss and loss of hair, even down the sides with the horseshoe pattern, and you're always concerned. So patients, younger patients, we always want to go on Propecia and possibly minoxidil as well. This fellow, I think we did probably 3,500 or 4,000 grafts in a sitting, and he's got great hair, nice donor site, nice thick hair at the back, and so by planting 4,000 grafts, we can give him a pretty full head of hair in one sitting. Makes a huge difference to have thick hair, not only thick hair in terms of number of grafts per square centimeter, but also thick shaft diameter in the back. It just creates a fuller look on top. Somebody with fine hair, almost no matter how many hairs you put up there, there's still a bit of a see-through look. It's if you've got fine hair at the back, it just is very difficult to create good density on the top of the head. This fellow, again, thick, bushy hair at the back, not only thick in terms of number of grafts, but also thick in terms of shaft diameter. And what we've done is just, he's the age where we can just sort of plant into his temporal angles on both sides. So we've just planted, I think we did sort of probably 1,500 to 1,800 grafts, and half on this side and half on the other side, and just created a nice, nice hairline. He had quite a recession here. And people, quite often you see this, and it's very difficult for these people to style their hair because they have a big lump at the front, and then there's very little in behind. So they can't really part it because of this, and they can't. So anyway, this fellow was very happy and has done very well with his transplant. And this is the same. This fellow's hair is a little bit finer, and so you can see it's a bit more see-through here, and especially at the back, you can see a bit of scalp. But we put, my guess is sort of 3,000 to 3,500 or 2,500 graft FUE. And probably the reason why we got 2,500 is he doesn't have the greatest density at the back either. This fellow, we just did the top of his head, his crown area, and just kind of filled in 3,200 grafts, and was very happy with the results. And again, curly hair usually does better as well, just because it just, you don't need as many hairs. Since it curls back on itself, you don't need as many hairs to make it look thick. And again, this person just wanted the whole top filled up, whole top of their head, and 3,400 grafts to the top, and had a nice result. And the same here is just 3,000 or 4,000 grafts to the crown area, and fill that up as well. This fellow has nice thick hair at the sides and the back as well. Now the concern with somebody like this is if they did continue to lose in the front here, and obviously patients are told this when they come in. When they come in, is that it's important to realize that if they do lose the front area, as time goes on, if they're not taking Propecias, they'll have to come back for another session. Now, one thing we've been doing over the last year is micropigmentation, which is temporary tattooing of the scalp. I was at a conference last May in Rome and saw it being done and was very interested, so I went back with one of my staff to do some training. We actually did some training in micropigmentation over the summer locally here, and then but not in scalp micropigmentation, in sort of eyebrow and eyelash, and so we went back to Milan and did some training with people that did do micropigmentation of the scalp. And I actually had my scalp done. I had my own scalp done by my staff person, and it basically what it is just tiny dots on the scalp, and it creates the illusion of hair in the right patient. It's done with no local anesthetic, lasts a year or two, and At first, I was thinking it would be good for sort of the shaved effect, but I've seen actually a fair number of patients from that have had that's been attempted in, and they haven't been that happy with the results. So I'm using it almost exclusively just to hide wide donor scars, people that have old scars that are wide that they can't hide in the back of their head, and also for people that just want to increase or give an appearance of increased density on the top of their head. And that definitely, in those two circumstances, works very well. This shows somebody with a wide donor scar, and you can see what we do is just put dots above and below. And with the hair up, it definitely becomes much less visible. Part of the problem that people have when they have these wide donor scars is that if they keep their hair too short, you can see the white underneath. And although it's obviously as dots when you lift the hair up like that, definitely when the hair is sitting down, patients are able to keep their hair quite a bit shorter than they would otherwise. This is just this is actually a patient I operated on. She was in the office yesterday, and she had a very sad case of what in India sometimes, if a male is unhappy with a female, for whatever reason, they'll throw acid in her face. And she had scarring to one side of her face, and as you can see, we've done her eyebrow as well as the left side of her hairline and left temple. And she actually was in the office yesterday, and it's looking amazing. She's a very happy woman for sure. She's going to go through surgery to repair this side of her nose over the next few months, and probably September she'll have a new artificial eye put in, and by the time we're finished with her, she should look very good. She'll have some discoloration here, but we should almost be able to restore. Unfortunately, well, we'll see what we do with the eyelash, but it's amazing what they can do with fake eyes now in terms of artificial eyes to restore the rest of that. Cosmetically, it'll look pretty good in a year's time. This fellow, we did a couple of thousand grafts. This is again a strip just to widen the frontal forelock, and was very happy. One sitting, and again, people that do best with transplants are people with very thick shaft diameter. He's got nice thick hair in the back. I've actually at the office got some nice pictures of his hairline, which is amazing. It's really thick. Now this, just going to talk briefly about Instant Hair as a product. I'm sure everybody's heard of. The most popular one on the market is Topic, but I've basically mimicked it, and it's quite a bit cheaper, and just will make your hair look thicker. And that's about it. So if people have questions, I see there's